Hey everyone, Brad Bryant with Our Senior Journey. Medicare is one of the most significant social programs in the history of the United States. It provides health care to millions of Americans. But where did it start? Where was the beginning? Let's take a journey through the inception of Medicare on through its evolution in the last several decades. To start, we have to go back to the early 20th century, the 1930s. President Franklin Delano Roosevelt actually had a vision for some sort of healthcare coverage for the entire United States as he was putting his vision together for his Social Security plan. Now, recall, Social Security started back in 1935, but his healthcare vision didn't make it to fruition. There was too much opposition, too much pushback because it was a brand new conversation to everyone. But that push continued through the 30s, through the 40s. And one of the big proponents in the 1940s was President Harry S. Truman. So in 1945, President Truman did introduce the first health care proposal to the legislature, but again came into a lot of pushback, and it too failed. So as the conversation was getting more broad, more people were getting accustomed to it, it still didn't quite make it. So there still was some work to do. President John F. Kennedy campaigned for health care, but he too met opposition. So he never did get that piece of legislation done. But after he was assassinated and then Lyndon Johnson took over, President LBJ, he did get a Medicare legislation passed in 1965. In fact, July 30th, 1965. So we're coming up on a 60-year anniversary for Medicare, a significant milestone. It was established under the Social Security amendments and included Medicare Part A and Medicare Part B. Those were the two original pieces of Medicare back in 1965. And an interesting note is that the very first recipient of what we now know as the original Medicare card, that red, white, and blue card, the original recipient was President Harry S. Truman, and that was for recognition of his advocacy for a national health care program. Now, through the decades, Medicare has expanded. It's added beneficiaries, it's added services. In fact, in 1972, President Richard M. Nixon did add people under age 65 with disabilities and those folks with ESRD, end-stage renal disease. So two big key components, additions to Medicare back in 1972. And then in 1997, under President Jimmy Carter, Medicare Part C or Medicare Advantage was added. So another big piece, another significant addition to Medicare in 1997. But at that time, it still only included Medicare Parts A and Medicare Part C, forming Medicare Part C. So still to come was Medicare Part D, which happened under the George Bush administration in 2003 under the MMA Act. So Medicare Part D, the prescription drug program, which there was a lot of pushback back in 2003, but that was also passed and added to what we now know as Medicare Advantage plans, which combines Medicare Parts A, B, and D to form Medicare Part C. The most recent significant piece of legislation is the Inflation Reduction Act of 2022, the IRA Act. Now, nothing took place for Medicare until this year, 2025, and then coming up in 2026. But the biggest component in 2025 is that now the most that you can spend or have to spend on any particular drug under your Part D plan is $2,000. It's capped. So that's a significant change for a lot of people that were spending thousands of dollars on some very expensive drugs. So another expansion for Medicare, which made things just a little bit easier for a lot of folks out there. It also gives the government the ability to negotiate pricing with drug companies, which is another significant move forward to help keep those drug costs down. So modern Medicare is always going to have its challenges, right? We've got an aging population. We've got rising medical costs. And of course, there's always the conversation about how we're going to fund Medicare to keep it going forward. But I think everybody would agree that Medicare has changed for the better the healthcare delivery system, especially for those folks over age 65 and those that do qualify under age 65. But we do have to keep having that conversation to make sure that we help Medicare evolve for future generations. Our job is to keep you informed of any changes that do come about, and also our job is to help you in your particular situation. So if you're coming up on Medicare, turning 65, or you're already there and have questions about your particular plan, Please get on our calendar, get on a phone call. Let's spend 15, 30 minutes together and talk about your situation. Hit the like and subscribe, and we will talk to you soon.